Recently, the Department of Health has been eyeing giving second booster shots for certain groups of people. In fact, the national government is now looking at the possibility of giving a second coronavirus 2019 booster shots to a specific group of people, including senior citizens and immunocompromised individuals who are at most risk for hospitalization and death due to coronavirus infection. Who else would be candidates for the second dose of booster shots? Let's watch this. Countries including the UK, Sweden, Israel, and Denmark are presently offering the shots to immunocompromised patients or at risk groups, including older individuals, especially with the recent surge of COVID-19 infection in those countries. We all know that the uptick in cases also followed after the removal of almost all pandemic restrictions in those countries, making some increase in COVID-19 infections very likely. The directive is apparently not new, since there has been ongoing evidence of waning immunity of COVID vaccines and new COVID surges across Europe and Asia, including nearby countries. There's definitely no question about data demonstrating waning immunity against Omicron after the first round of immunization justifies the first booster shot for all adults. But the data are less compelling when it comes to whether or not a second booster shot is warranted. While a fourth dose or the second booster appears to be beneficial at preventing severe disease in older or high risk individuals, it is not really clear whether younger groups can truly benefit much from the second booster shot. Remember, the key goal of vaccination should be at reducing serious illnesses from COVID, that for most people, the two shots of any COVID vaccines have been shown to provide sufficient protection. We likewise have some evidence that the vaccine effectiveness is slipping against Omicron, notably among the older people and kids between 5 and 11, and that these vulnerable people who were boosted months ago may want to get another dose, but for anyone else, it remains a choice and probably, in my opinion, not needed. Given the low rates of transmission and cases now in most parts of our country, now under alert level 1, I believe that the need for the fourth shot is really not needed at the present time or immediately. If at all in the future, when booster shots may be needed, then I would suggest that there should be a targeted, not blanket, one size fits all booster policies should be formulated. At present time, the medical experts advising the government in Israel recommend that making fourth doses available to all adults. But just like us, the US officials have previously said that these fourth doses may actually not be needed. But we will continue to monitor emerging data to evaluate the need for additional boosters. So, what is it for now? Is it time for the fourth dose? Well, for most people ages 12 and older, we are considered so far up to date with our COVID-19 vaccines if we receive either 3 doses of the mRNA shots or 2 doses of the Johnson& Johnson with a heterologous booster or 2 doses of the Sinovac with a homologous or heterologous booster shot. Data have shown that after booster doses, the effectiveness actually slowly drops from 91% effectivity to approximately 78% 4 months after the shot. A big question, therefore, is what happens down when we get to the 6 months, 7 months, or 8 months after the third dose, when in fact 78% effectivity may continue to go further down. It is for this reason that our government is pushing for the fourth dose in serious consideration for the elderly and those with certain underlying health conditions. But again, the booster shot will not be for the general population. In a study, for example, published in the New England Journal of Medicine among younger healthcare workers in Israel, adding a fourth dose for people vaccinated and boosted with Pfizer did not significantly have any added benefits, but instead only received marginal benefits from an additional fourth dose. I therefore believe that we have to accept the notion at present that vaccination is not one size fits all policy, but rather some of us may need a three-dose vaccine in certain groups and a two-dose vaccine in others. We just therefore cannot give additional doses to all as everything has cost, including boosting, and one has to weigh in the risk of side effects. As of now, the truth is we really don't know if we are going to need a second booster, but as long as this virus hangs around, I would not be surprised if we are going to need one more shot in the near future. Given the fact that we have waning immunity, I suspect we may need a regular boost at intervals yet to be determined. Again, this is Dr. Jerry Tan. Stay safe. See you around.